Hello everyone, let's discuss cardiac tamponade. Cardiac tamponade is a compression of heart by pericardial fluid leading to decreased cardiac output. What we mean by this? In a normal circumstances, the heart is surrounded by two membranous layers, the outer parietal layer and the inner visceral layer. In between these two layers, there are neofluid. Sometime under malignancy or infection or some other pathology, there is an accumulation of fluid around the heart. It is called as pericardial effusion. This pericardial effusion, when increase in amount, it start compressing the heart. When it start compressing the heart, it is called as a cardiac tamponade. As a result of this compression, the heart cannot expand and contract properly, which lead to decreased cardiac output. So as a result of this decreased cardiac output, the patient will present with variety of clinical feature. Clinically, the patient will present with Becks Triad, increased heart rate and the pulsus paradoxus. What is meant by Becks Triad? The Becks Triad is a triad of a clinical feature which is characteristic to cardiac tamponade. It includes hypotension, distended neck vein and the distant heart sound. The hypotension is produced because the heart cannot blood pump forward. So as a result of this failure, there will be a hypotension. As a result, there will be also accumulation of backward pressure in heart, which lead to distended neck vein, and the heart is floating in a fluid, so it cannot produce a proper heart sound. So there will be a distant heart sound. So these three clinical findings, hypotension, distended neck vein and the distant heart sound, are characteristic of cardiac tamponade. The second one is increased heart rate. The patient will have increased heart rate. The third one, the pulsus paradoxus. What we mean by pulsus paradoxus? The pulsus paradoxus mean decrease in amplitude of a systolic BP by 10 mm of Hg during inspiration. Normally during inspiration there is a decrease of systolic blood pressure. But when this systolic blood pressure decrease more than 10 mm of Hg, it is called as a pulsus paradoxus. It occur in cardiac tamponade but is also associated with other conditions such as asthma, obstructive sleep apnea, pericarditis and croup. These are the characteristic finding in cardiac tamponade. Now come toward the diagnosis, that how we will diagnose a case of cardiac tamponade. For diagnosis we use three tests: echo, X-ray and ECG. The echo is diagnostic in cardiac tamponade. It shows the right atrial and right ventricle diastolic collapse and echo-free zone around the heart. Chest X-ray, you will see enlarged globular water bottle shaped heart with large effusion. As you guys can see in this X-ray that there is a enlarged globular shaped heart with water bottle shape. This is a water bottle and the heart resembles the shape of water bottle. So it is called as a water bottle shaped heart. Last, on ECG we will see the electrical alternance. The electrical alternance is a diagnostic ECG finding of cardiac tamponade. You guys can see this ECG. This is a characteristic ECG of electrical alternance. What is electrical alternance? As you guys can see that the QRS complex are of different voltage. You guys can see that some QRS complex are high voltage and some are low voltage. This is called as electrical alternance and it is produced because the heart float in fluid. So due to this floating mechanism, the heart cannot maintain the constant electrical activity, so it will produce QRS complex of different voltage called as electrical alternance. But remember that the globular shape or the bottle shape heart and the electrical alternance are very late finding in cardiac tamponade. These signs are usually produced when there are large pericardial effusion around the heart. It was all about the diagnosis of cardiac tamponade. Now let's come toward the treatment of cardiac tamponade, that how we will manage a patient with cardiac tamponade. The first step is aggressive volume expansion with IV fluid. Second one is urgent pericardiocentesis, mean that aspire the fluid from pericardial cavity and send this fluid for lab to identify the etiology of pericardial effusion which is causing cardiac tamponade. But if these measures fail, such as if a patient present with recurrent cases or the decompensation, then the last treatment option is pericardial window. By the pericardial window we mean that we create a window in a pericardial cavity so the fluid will drain into chest or abdominal cavity. So it was all about the cardiac tamponade. If there's still any question, you guys can ask and stay tuned for more update.